The breast, axilla, upper are innervated by a variety of nerves. The lateral cutaneous branch of intercostal nerve T2, T3, and T4 provide innervation to the anterior chest wall and upper back and the torso and the nipple. Sympathetic innervation of the cutaneous structure of the breast is provided by the medial and lateral branches of the ventral lemmas of the third to sixth intercostal nerve. While both nociceptive pain due to damage of the muscle and ligament and neuropathic pain can occur after surgery for breast cancer. Neuropathic pain is more likely to persist after wound healing has occurred. Four pain syndrome can be distinguished. Phantom breast pain is a painful, often knife-like or shooting sensation that the removed breast is still present. Intercostobrachial neuralgia, usually known as post-mastectomy pain syndrome, causes of pain in the axilla, medial upper arm, and anterior chest wall, and is often caused by nerve damage during axillary nerve dissection. Neuroma pain can occur from the scar after either mastectomy or lumpectomy, but is more common if the surgery is followed by radiotherapy. Other nerve injury pain can occur even if the intercostobrachial nerve is spared, and is more common in breast reconstruction and implants. So the answer is intercostobrachial neuralgia. Pain along the medial aspect of the arm in a post-mastectomy patient is due to intercostobrachial neuralgia. Investigation of choice in cases of a patients with episodic hypertension, headache, and thyroid nodule. Options are urinary basic amino acid metabolites, urinary HIA, then thyroid function test, urinary catecholamines, aspirations of the nodule. So this patient is having MEN type 2 syndrome, which is characterized by pheochromocytoma and medullary carcinoma of the thyroid. Urinary catecholamines are increased in the pheochromocytoma. Aspiration of nodule will show amyloid material. So investigation of choice in case of a patients with episodic hypertension, headache, and thyroid nodules is urinary catecholamine and aspiration of the nodule, because this patient is having MEN2 syndrome, where pheochromocytoma, medullary thyroid carcinoma, and urinary catecholamines are increased. So it shows hypertension, headache, and thyroid nodule. So answer is urinary catecholamine and aspiration of the nodule. So a 45-year-old man presents with weeping eczematoid lesions of her nipple, which of the statement is false concerning a diagnosis management. So the treatment is with warm, compressed, and oral antibiotic. Biopsy of the nipple revealing malignant cells within the milk duct is invariably associated with underlying invasive carcinoma. The lesion always represent high-risk disease with a significant risk of subsequent metastatic disease. The appropriate treatment is mastectomy. So false concerning a diagnosis. So the false concerning a diagnosis is warm, compressed, and oral antibiotic. Biopsy of the nipple revealing malignant cells within the milk duct is invariably associated with underlying invasive carcinoma is true. The lesions always represents a high-risk disease with significant risk of subsequent metastatic disease. True. The appropriate treatment is mastectomy is true. On FNAB, the test cells are cuboidal with pale abundant cytoplasm, crowded nuclei that may demonstrate grooving, and intranuclear cytoplasm lesions, often in a nuclei. The diagnosis papillary carcinoma thyroid. For papillary carcinoma thyroid, the diagnosis is established by characteristic nuclear cellular fissure cells are cuboidal with pale abundant cytoplasm, crowded nuclei that demonstrate grooving, and intranuclear cytoplasmic lesions, leading to demonstrations of often any nuclei, which allows diagnosis by FNAB. Sarcoma bodies which are microscopic calcified deposit representing clumps of slough cells also may be present. Concerning breast development before and during pregnancy, which hormone activity pairing is incorrect? Estrogen initiates ductal development. Follicular stimulating hormone, Hooper ligament relaxation. Prolactin initiates lactogenesis, and progesterone initiates lobar development. So estrogen initiates ductal development, whereas progesterone is responsible for differentiation of epithelium, and for lobar development, progesterone is responsible for differentiation of epithelium. Estrogen is responsible for ductal development, and progesterone is responsible for differentiation of epithelium and for lobular development. Prolactin is the primary hormone stimulus for lactogenesis in late pregnancy and postpartum period. The gonadotrophin luteinizing hormone and follicular stimulating hormone regulates the release of estrogen and progesterone from the ovaries. In turn, the release of LH and FSH from the basophilic cells of the anterior pituitary is regulated by secretions of gonadotrophic releasing hormone from the hypothalamus. So Incorrect. So follicular stimulating hormone Cooper ligament relaxation is wrong. That is follicular FSH regulator. LH and FSH regulates the release of estrogen progesterone from the ovaries. Prolactin initiates lactogenesis. Progesterone initiates lobar development. Estrogen initiates DAX development. Drugs useful in breast cancer prevention includes all of the following, except also the P2 trial, the study of the tamoxifen and raloxifene, known as STAR trial, randomly assigned a postmenopausal woman at the high risk for breast cancer to receive either tamoxifen or raloxifene. The initial reports of the P2 trial showed the two agents are nearly identical in their ability to reduce the breast cancer risk, but raloxifene was associated with more favorable adverse event profile. An updated analysis revealed that raloxifene maintained 76% of the efficacy of the tamoxifen in prevention of invasive breast cancer with more favorable side effects. Aromatase inhibitors have been shown to be more effective than tamoxifen in reducing the incidence of congenital breast cancer in postmenopausal women receiving aromatase inhibitor for adjuvant treatment of invasive breast cancer. So the answer is tamoxifen, aspirin. Which of the statement is true concerning intraductal papilloma? Serous non-bloody discharge is unlikely to be due to intraductal papilloma, and isolated lesion is considered pre-malignant. And non-palpable lesions can often be diagnosed with mammography. The lesion is the most common cause of bloody nipple discharge. So intraductal papilloma represent the most common cause of bloody nipple discharge. Although in half of the cases the discharge is serous. Serous non-bloody discharge is seen in intraductal papilloma. Then, since the average size of intraductal papilloma is 2 to 4 mm, they are rarely palpable. Ductography may demonstrate a lesion, or it may be found after subareolar duct excision performed to treat discharge. An isolated intraductal papilloma is not considered pre-malignant, nor does it place the patient at increased risk for breast cancer. Unlikely isolated papillomas, diffuse papillomatosis is associated with increased risk of breast cancer, perhaps as high as in 40% of the patient. So, non-palpable lesion may be diagnosed with mammography. An isolated intraductal papilloma is not considered pre-malignant, nor does it place the patient at increased risk of breast cancer. So, isolated lesion is not considered to be pre-malignant. A non-palpable and ductography may demonstrate the lesion, or it may be found after subareolar duct excision performed to treat the discharge. So the lesion is the most common cause of bloody nipple discharge is correct. The tumor which may occur in the residual breast or overlying skin following wide local excision and radiotherapy for mammographic carcinoma is angiosarcoma, squamous cell carcinoma, leiomyosarcoma, basal cell carcinoma. Angiosarcoma is a vascular tumor which may arise de novo in the breast or as a complication of radiotherapy. Sebastian writes, this vascular tumor may occur de novo in the breast, but clinically important presentation is in the penis after radiation or in the lymphadenomatous upper extremity following radical mastectomy. So, this angiosarcoma. A blood-stained discharge from the nipple indicates duct papilloma. Bloody discharge is more suggestive of cancer, but is usually caused by benign papilloma in the duct. Intraductal papilloma is the most common cause of bloody nipple discharge. Also, the nipple discharge is suggestive of cancer if it is spontaneous, unilateral, localized to a single duct, occurs in women aged 40 years or more, is bloody or is associated with a mass. Nipple discharge is suggestive of benign condition if it is bilateral or multiductal in origin, occurs in women aged 39 years or less, or is milky or blue-green in color. So it is a nipple discharge is suggestive of benign condition if it is bilateral or multiductal in origin, occurs in a woman who is aged 39 years or less, or is milky or blue-green in color. Which of the following statements about normal breast anatomy is true? The tail of spans extend across the anterior axillary fold. The breast typically contains 10 lobes. The upper inner quadrants of the breast contains the most breast tissue. Cooper's ligaments are only found in the upper quadrant of the breast. The breast is composed of 15 to 20 lobes, which are each composed of several lobes. Fibrous bands of connective tissue travel through the breast, insert perpendicular into the dermis, and provide structural support. The major female breast extends from the level of second to third rib to the inflammatory fold at the sixth or seventh rib. It extends transversely from the lateral border of the sternum to the interaxillary line. The deep or structural surface of the breast rests on the fascia of the pectoralis major, serratus anterior, and the external oblique abdominal muscle, and the upper extent of the rectus sheath. The retromammary bursa may be identified in the posterior aspect of the breast between the investing fascia of the breast and the fascia of the pectoralis major muscle. So, Cooper ligaments. Which of the following statements about are true about breast anatomy? The tail of spine extends across the anterior axillary fold. The breast tissue typically contains 15 to 20 lobes. The upper inner quadrants of the breast contains the most breast tissue. The upper so the female breast extend from the level of second or third to the inframammary fold. The deep or posterior surface of the breast rests on the pectoralis fascia. The retromammary bursa are identified on the posterior aspect of the breast. The upper outer quadrant of the breast contains the most breast tissue. The Cooper ligament are only found in the upper quadrant of the breast. So Cooper ligaments are bands of connective tissue insert perpendicularly into the dermis and provide the structural support. So it is not only present in the upper quadrant of the breast. So, failure to perform radiation after wide excisions of an invasive cancer risk. Which of the following outcome? Failure to perform radiation after wide excisions of an invasive cancer risk. Which of the following outcome? So recurrence of the cancer is in the epilateral breast. Then regional nodal recurrence, greater chances of breast cancer, shorter survival rate. So retrospective views and prospective surgical trials agree that omissions of the breast radiation after wide excision leads to a higher rate of ipsilateral breast recurrence. However, survival and the risk of distant disease are not altered in patients treated by excision alone within the follow-up time of studies and given their inherent power to detect difference in outcome. So failure to perform radiations after wide excisions of the invasion of the breast cancer, it leads to recurrence of the cancer in the ipsilateral breast. There is no change in regional nodal recurrence or greater chances of breast cancer mortality is not there, and survival, there is no shorter survival time. So survivals are not altered. So the answer is recurrence of the breast in the ipsilateral breast. The 33-year-old woman is referred with nipple discharge. Which of the following statement are true concerning her diagnosis and management? So expressible bloody nipple discharge should be evaluated with ductogram. At one time or another, many women notice a nipple discharge. The most common physiologic basis for nipple discharge is lactation. Milk may continue to be secreted immediately for as long as 2 years after breastfeeding has stopped, particularly with breast stimulation. A milky whitish discharge, usually bilateral, that is not related to location or milk's breast stimulation, is termed as galactorrhea. The presence of bilateral galactorrhea should prompt an evaluation for underlying endocrinopathy causing increased prolactin secretion by the pituitary. Classically, this is associated with amenorrhea, but galactorrhea may be the only signs of hypoprolactinemia. Nipple discharges associated with fibrocystic disease are generally green, yellow, or brown. Introlactate papillomas and cancer lead to bloody or blood-tinged serous discharge. The brownish discharge of fibrocystic disease can easily be confused with old blood. Simply dabbing of discharge with gauze pad and examining the stain can usually differentiate the two. So, 33-year-old woman is referred with nipple discharge. Which of the following is true concerning diagnosis? Expressible bloody nipple discharge should be evaluated with ductogram. So, milky breast discharge would not be expected 1 year after discontinuation of the breastfeeding. So, the milk may continue to be secreted for as long as 2 years after breastfeeding has stopped, particularly with the breast stimulation. So, the galactorrhea is suggestive of an underlying endocrinopathy. Milk may be continued to secrete immediately as long as 2 years. A milky whitish discharge is usually bilateral, and that is not related to lactations or breast stimulation is termed as galactorrhea. The presence of bilateral galactorrhea should prompt an evaluation of underlying endocrinopathy causing increased prolactin secreted by the pituitary. Classical, this is associated with amenorrhea, but galactorrhea may be the only signs of hyperproteinemia. So, unilateral galactorrhea is bilateral galactorrhea is having endocrinopathy, underlying endocrinopathy. So, the excessive blood in nipple discharge should be evaluated with ductogram. True, unilateral galactorrhea is suggestive of an underlying endocrinopathy. That is wrong. 14-year-old black girl had her right breast removed because of large mass. The tumor weight 1400 gram was found to have a bulging, very firm lobulated surface with a wall-like pattern. The neoplasm is most likely fibroadenoma. Screening methods for medullary carcinoma thyroid is serum calcitonin. As already explained above, medullary carcinoma thyroid can be of two types: sporadic, that is 2B, and familial cases without Mann syndrome. The familial medullary thyroid carcinomas are more aggressive, multicentric, and present at younger age. Therefore, high-risk cases should be screened for medullary thyroid carcinoma by detecting RET mutation. The genetic screening tests are supplemented by estimating serum calcium level in the basal state and after stimulation by either calcium or pentagastrin. Prophylactic total thyroidectomy is indicated in RET gene mutation cases once the mutation is confirmed. Not true about gynecomastia is Klinefelter syndrome seen in cryptorchidism can be drug-induced, none of the above. Gynecomastia is hypertrophy of the male breast more than usual due to increase in the ductal epithelium, and connective tissue, and stromal elements often retaining features of female breast. It can be unilateral or bilateral. Bilateral can be symmetrical or asymmetrical. Etiology is estrogen excess, increase in estradiol secretion due to testicular tumor, Leydig cell or non-testicular tumor from the adrenal cortex, lung, liver, hyperthyroidism, liver disease, estrogen therapy for prostate cancer, androgen deficiency, aging, Klinefelter-Coleman syndrome, ACTH deficiency, secondary testicular failure, cryptorchidism or chidism, inhibitions of testicular synthesis, cimetidine, phenetidine, spironolactone, estrogen synthesis, increased estrogen activity, drugs like digitalis and furosemide, anabolic steroids, estrogen synthesis, reserpine. So, not true in gynecomastia. It is not true. Everything is true. It is seen in Klinefelter syndrome, seen in cryptorchidism, and can be drug-induced also. Treatment of breast cancer with pregnant lady in first trimester. Options are radiotherapy, MTP followed by treatment according to protocol, neoadjuvant chemotherapy, breast conservation. So first trimester, MRM, modified radical mastectomy. If axillary node is positive, then pregnancy is terminated. Chemotherapy is given in second trimester. MRM chemotherapy carefully in third trimester. MRM after delivery. Chemotherapy in suppression of lactation. Complications of total thyroidectomy include all of the following, except options are hoarseness of voice, hemorrhage, hypercalcemia, airway obstruction. Rates of post-procedure hypocalcemia are approximately 5%. It results in 80% of the cases in approximately 12 months. So other complication includes hemorrhage, damage to recurrent laryngeal nerve and superior laryngeal nerve, respiratory obstruction due to laryngeal edema, or very rarely due to collapse or kinking of the trachea. So the complications of total thyroidectomy includes hoarseness of voice, hemorrhage, airway obstruction, and hypocalcemia, not hypercalcemia. Prognosis of carcinoma breast depends on the lymph node status, skin involvement, size of the tumor, beauty, orange. Metastasis to ipsilateral axillary lymph nodes predicts outcomes are surgery more powerfully than tumor size does. The single most important predictor of 10 and 20 years survival rate in breast cancer is the number of axillary lymph nodes involved in metastatic disease. Which of the following is true concerning mammography? The sensitivity of the mammography decreases with age. 1/3 of palpable breast cancer are not detected by mammography. The sensitivity of the mammography decreases with years. Then 1/3 of the palpable breast cancers are not detected by mammography. And American Cancer Society currently recommends routine screening mammography beginning at the age of 50. Up to 50% of the cancer detected mammographically are not palpable. Although mammography has been available for years, it is not become widely used until the finding of the Health Insurance Plan of New York or the breast cancer detection demonstration project studies of screening mammography were disseminated. These and other investigators demonstrated that 10 to 50% of the cancer detected mammographically are not palpable. Conversely, palpable recognizes 10 to 20% of tumors not. Although mammography has been available for years, it did not become widely used until the finding of the Health Insurance Plan of New York and the breast cancer detection demonstration project studies of screening mammography were studies of screening mammography were disseminated. This and other investigators demonstrated that 10% to 50% of the cancer detected mammographically are not palpable. Conversely, palpable recognizes 10% to 20% of 10% to 20% of tumors not detected mammographically. The incidence of breast cancer begins to rise sharply at the age 40, and the sensitivity of the mammograms increases with the age as the dense parenchymal tissue of the young woman is progressively replaced by fatty tissue. Routine screen mammography has been shown to decrease the breast cancer-related mortality in asymptomatic women over the age of 50. Controversy exists concerning the role of screening in young women. However, currently the American Cancer Society recommends that mammographic screening begins at 40. Although the screening sensitivity in the mammography is not specific, only about 25% of non-palpable lesions detected mammographically are found to be malignant biopsy. A speculated density with ill-defined margins on mammography is almost certainly malignant. Most common features are seen as sensitive but not diagnostic of cancer. This includes cluster microcalcification, asymmetrical density, fractal asymmetry, distortions of normal breast architecture, and or skin or nipple distortion. So, which of the following statement is true? So, the sensitivity of the mammography decreases with age. 1/3 of the breast cancers are not detected by mammography. 10 to 50% of the cancer detected mammographically are not palpable. And American Cancer Society currently recommends routine screening mammography. Beginnings at the age 50. So it begins at the age 40. Up to 50% of the cancer detected mammographically are not palpable. It is correct. So true statement regarding metastasis of the breast include does not involve axillary lymph nodes because it is a manifestation of intraductal carcinoma only. Accounts for 10 to 15% of all newly diagnosed breast cancers. Presence with nipple areolar eczematous changes usually precedes developments of Paget's disease of the bone. Paget's disease of the breast is unrelated to the Paget's bone disease. It represents a small percentage of breast cancer and is thought to originate in the retroareolar lactiferous ducts. It progresses towards the nipple areolar complex in most patients, where it causes the typical clinical finding of the nipple eczema and erosion. Up to 20% of the patients with Paget's disease have an associated breast mass, and these patients are not likely to have involvements of axillary nodes. So it represents a small percentage, 1 to 50% of all breast cancer, and is thought to originate in the retroareolar lactiferous ducts. It progresses towards a nipple areolar complex in most patients, where it causes a typical finding of nipple eczema and erosion. Up to 20% of patients with a Paget's disease have an associated breast mass, and these patients are not likely to have involvement of axillary lymph nodes. Nipple areolar disease. So these patients are more likely to have involvements of axillary nodes. Paget's disease have an associated breast mass and are more likely to have involvements of axillary nodes. Nipple areolar disease alone usually represents in situ cancer. These patients have a 10-year survival rate of over 80%. In contrast, if the Paget's disease presents with the mass is likely to be infiltrating ductal carcinoma. So the generally concomitant surgical procedure for Paget's disease is currently a modified radical mastectomy. The validity of breast saving surgery and adjuvant sedation therapy for patients without an associated mass is under investigation. So the true statements regarding Paget's disease of the breast include does not involve axillary lymph nodes. False accounts for 10 to 15% of all newly diagnosed, no 1 to 2% of all diagnosed breast cancer. When present the nipple areolar exomatous changes true, usually develops a bone metastasis of bone. False. The best imaging to assess the breast of patients with implant is MRI. MRI is the best imaging modality of the breast of women with implants. MRI is the investigation of choice to screen high-risk individuals. It is useful in assessing local. A 40-year-old female with a family history of breast carcinoma presented to the OPD with a normal mammography report. The next investigation of choice to evaluate for breast disease would be MRI. MRI is helpful in screening of a high-risk individual. It is a most sensitive imaging modality, but it should be done after initial radiological evaluation, in which the result may be inconclusive. Where the patient is a high-risk individual, since there is family history of breast carcinoma, hence MRI is done after initial radiological evaluation to confirm the presence or absence of malignant changes. Venous grading of for ductal carcinoma in situ does not include size, presence of microcalcification, age, hormonal receptor. DCI is classified using venous system, which combines the patient's age, type of DCIS, like nuclear grading or necrosis, presence of microcalcification, extent of resection margin, and size of the disease. Patients with high score benefit from radiotherapy after excision, whereas those of low grade whose tumor is completely excised needs no further treatment. Staining of estrogen and progesterone receptors is now considered routine, as their presence will indicate the use of adjuvant hormonal therapy with tamoxifen or aromatase inhibitor. So this is not a part of a venous system. The drug used in estrogen-dependent breast cancer is tamoxifen. The most commonly used flap for breast reconstruction is transverse rectus abdominis mycogenous flap. At the present time, the gold standard is breast reconstructions with autologous tissue is the transverse rectus abdominis mycogenous flap, because lower abdominal tissues are similar in consistency to breast tissue. The patient has a tumor in the breast of size 6 to 3 cm with adherence to the pectoralis major muscle. The dermis of the underlying skin is found to involve T-staging of the tumor. The tumor is of size 6 cm and hence it is stage 3, T3. Invasion or adhesion to the pectoralis muscle in the absence of chest wall involvement does not qualify T4. Similar involvements of dermis alone does not qualify as T4. So criteria for T4 are involvement of chest wall, invasion or adhesion to the pectoralis muscle in the absence of chest wall involvement does not qualify as T4. Okay. So the criteria for T4 is T4A. Involvement of chest wall. Chest wall includes serratus anterior intercostal muscle, ribs, pectoralis major muscle is not part of the chest wall. T4B. Involvements of the overlying skin includes ulceration. UD orange does not include dermis involvement alone and does not include dimpling of the skin, nipple retraction. So T4B doesn't involve dermis involvement of the dermis or doesn't involve dimpling of the skin or nipple retraction. So T4C is T4A, T4B. T4D is inflammatory carcinoma of the breast. So which of the following structure is not removed in Peters modified radical mastectomy? Pectoralis major muscle is not removed in Peters modified radical mastectomy. A modified radical Peters mastectomy removes all breast, nipple, areolar complex, skin level 1, 2, 3 and pectoralis minor. Important surgical surgeries for the breast cancer. Breast conservative surgery, also known as segmental mastectomy, lumpectomy, partial mastectomy, wide local excision and thylectomy. So thylectomy is excision of the lump. Simple mastectomy is palpable extents of the breast and overlying skin. And subcutaneous mastectomy is palpable extent of the breast without overlying skin. Total mastectomy is all breast tissue. Nipple areolar complex and skin. Then extended simple mastectomy plus removal of level 1 lymph node. Modified radical mastectomy is entire breast tissue plus nipple areolar complex plus skin plus axillary lymph nodes 1, 2. Then pectoralis minor removed Scanlon is pectoralis minor divided. And Auchinclosis pectoralis minor retracted. Then Halsted radical mastectomy, entire breast tissue, nipple areola complex skin level 1 to 3, pectoralis major minor. Extended radical is Halsted plus internal mammary lymph nodes. Extended radical mastectomy, urban and evergin. So Halsted plus internal mammary plus supraclavicular lymph node, and super radical mastectomy is Halsted plus internal mammary plus supraclavicular plus medicinal lymph nodes. Postoperative radiation is given in case of carcinoma breast mainly to prevent radiation. Radiotherapy to chest after mastectomy is indicated in selected patients in whom the risk of local recurrences are high. This includes patients large tumor and those with large tumor numbers of positive nodes or extensive lymphovascular invasion. There is some evidence that postoperative chest wall radiotherapy improves survival in women with node positive breast cancer. It is conventional to combine conservative surgery with radiotherapy to the remaining breast tissue. Which condition can mimic breast carcinoma both clinically and mammographically? It is a fat necrosis in a presence with palpable mass and calcification in mammography, mimicking carcinoma breast, but it has no malignant potential. Which is the most common variants of carcinoma breast? The invasion ductal carcinoma is the most common variant of the carcinoma breast. Arrange the following types of carcinoma in the order of the best to worst prognosis. Best to worst prognosis. Tubular carcinoma is the best prognosis among these, then medullary carcinoma, then inflammatory carcinoma, then invasive ductal carcinoma. So invasive ductal carcinoma, worst to best prognosis. Best to worst prognosis. Invasive ductal carcinoma is the worst prognosis. So tubular carcinoma has the best prognosis. Inflammatory carcinoma has the worst prognosis. The medullary carcinoma has better prognosis compared to invasive ductal carcinoma. Order of breast carcinoma from worst to best prognosis. Inflammatory carcinoma of breast is the worst prognosis. Then invasive ductal carcinoma. Then invasive lobular carcinoma. Then medullary carcinoma. Then colloid carcinoma, papillary carcinoma, cribriform carcinoma, adenocystic and tubular carcinoma. Consider the following statement about spasticity of the breast. It is malignant. Presence of spasticity is needed for diagnosis. Underlying carcinoma is usually LCIS and lobular carcinoma in situ, or the treatment is mastectomy. So Pez's disease is usually associated with underlying ductal carcinoma in situ. Pez's disease is the superficial manifestations of underlying. Pez's disease is usually associated with underlying DCIS. Pez's disease is superficial manifestations of underlying breast carcinoma. It accounts for 1% or less of breast malignancies. Clinical features present as chronic eczematous eruptions of the nipple. Progress to an ulcerated pubic lesion usually associated with extensive DCIS and may be associated with invasive cancer. Palpable mass may or may not be present. Diagnosing nipple biopsy will show populations of identical to DCIS cell like vegetoid features. Edge cells are pathognomic, large pale vagulated cell in the red cells of epithelium. Next, the prognosis of inflammatory breast carcinoma is better than mucinous carcinoma of the breast. Then best among all the type of breast cancer. Then moderately better compared to other invasive, and worse among all the type of breast cancer. So inflammatory breast cancer accounts for less than 3% of the breast cancer. Clinical features, it is characterized by skin changes of browny induration, erythema with a raised with a raised edge, and edema, pubic orange. There may be associated breast mass. Pathognomic hallmark is permeations of dermal lymph vessels by cancer cell is seen in the skin biopsy. Dermal lymph vessels by cancer cell is seen in the skin biopsy. Then axillary nodal metastases are common. There is a significant risk for distal metastasis. Treatment is combined modality. Treatment includes neoadjuvant chemotherapy, mastectomy, and radiation therapy with hormonal therapy for ER positives and trastuzumab for ER positive, HER2 positive. The annual risk factors for endodermal cancer is in post-breast cancer patients after 5 years of adjuvant therapy with tamoxifen in 2 cases per 1,000 women. The most common cause of discrete palpable breast lump is a benign cyst. All of the following characteristics are of benign cyst except they are commonly located in the upper outer quadrant and are well. Ultrasound of eye needle aspiration can distinguish solid from cystic lesion. They are less common in postmenopausal women not on the hormonal therapy. They are usually occurs in the 4th decade. So commonly occurs in the 4th decade and may fluctuate with the menstrual cycle and are usually found usually round or oval and well circumscribed, smooth, firm and mobile. Often have focal tenderness immediately over the site. Can be hard if the fluid is under tension. Must be evaluated by ultrasound or fine needle aspiration to distinguish solid from cystic lesion, and are less common in postmenopausal women not on hormonal therapy. By contrast, fibroadenomas commonly occurs in young women during the first half of the reproductive period, are stimulated to grow by exogenous estrogen or progestin, lactation and pregnancy. Typically are located in the upper outer quadrant as well as circumscribed, firm, rubbery, exceedingly mobile, non-tender, usually a characteristic ultrasonographic features. What percentage of breast cancer cases is related to genetic susceptibility? Genetic susceptibility to the breast cancer accounts for approximately 25% of all the breast cancer cases. So, in familial breast cancer mutation in the BRCA1, BRCA2, CHEK2, PP53, P10 genes account for approximately 5% to 10% of the breast and ovarian cancer cases overall. The prevalence of BRCA1 and 2 mutations varies considerably among ethnic groups and geographical areas. In North America, 1 in every 300 to 500 people is estimated to harbor BRCA germline mutation. A probe is inserted into the duct from which the discharge is emerging. At any second, incision is made and the flap is dissected to reach the duct. The duct is then excised. This process is known as microdocectomy. A female patient presents with breast abscess under antibiotic cover. Aspiration was attempted which fails to reveal any aspirate. The next step in management is a second attempt at aspiration. Stop antibiotic as no aspirate was collected. Incision and drainage. Continue antibiotic only. A second attempt at aspiration. So at the latest guidelines for management of breast abscess specify that at least 2 aspirations should be attempted before an incision and drainage is done. This aspiration should be made under antibiotic coverage. This often allows resolution without the need for an incision scar and allows the patient to carry on breastfeeding. A non-healing breast abscess should arouse the suspicion of either tuberculosis or inflammatory carcinoma of breast. Physiological gynecomastia occurs in iodocin known as senescence or all of the above. Physiologically, gynecomastia is seen in all of the above. The presence of accessory nipple is called polythelia. Polythelia is the presence of accessory nipple. Polymestia is the congenital anomaly with presence of accessory breast tissue. Accessory breast tissue is polymestia. Synnestia is a condition in which webbing between the breast at the midline is seen. Synnestia. Athelia refers to absence of nipple, and hemestia refers to congenital absence of the breast. The most common cause of nipple discharge in non-lactating breast is intraductal papilloma. Intraductal papilloma is the most common cause of nipple discharge in non-lactating breast, followed by dark ectasia. Intraductal papilloma and then dark ectasia. A lady presents with a galactoria and visual defect. First investigation of choice is MRI. MRI is an imaging of choice for pituitary tumor. It is preferred over CT scan. Here the galactoria with a visual defect represents pituitary tumor. It is prolactinoma. Thus, the first investigation in MRI is MRI, but some prolactin should be measured. Levels more than 2000 nanogram per ml is diagnosis of prolactinoma. BRCA1 is found on which chromosome? Is 17. About half of the women with hereditary breast cancer have a mutation in BRCA1 on 17 chromosome, and before BRCA2 is chromosome number 13. BRCA1 is 17 and BRCA2 is 13. Regarding the breast cancer, which of the following statement is true? Breast cancer occurs more commonly among women of the low socioeconomic cases. That a history of the breast cancer in a first degree family related to associated with a fourfold increase. Women with the first child but after age of 30 are approximately twice the risk of those first before 18 years. So women with the first birth age 30 years have approximately twice the risk of those with the first birth before age 18. So risk factors for breast cancer, family cancer includes family history and hereditary previous breast cancer, early menopause, menopause. A late age at the first birth doubles the risk of breast cancer compared with the early parity, having one category related with the breast cancer also double studies. One with the upper socioeconomic measures by their equations or income have been found to have a highest incidence. Neither cigarette nor the use of their hair dye has been correlated with their breast cancer. So, first thing, breast cancer occurs more commonly in the higher socioeconomic classes. Then a history of breast cancer in a first degree, it doubles the risk. Then cigarette smoking will not increase the risk of breast cancer. So, answer is women. Answer is C. So, breast cancer locally spread to all of the following muscles except it is useful in assessing locoregional spread, multifocality, and multisensitivity of the cancer in distinguish scar from recurrence. Recommended age for starting screening of mammography is 45 days. Routine age of starting screening